My name is Rachel. I'm a nurse patient navigator with UCSF Orthopaedics. This presentation is designed to help you prepare for knee replacement surgery. During this presentation, we will review a variety of topics that will cover preparing for surgery, as well as the post-surgery recovery. We will start with knee anatomy, as well as information on the implants that are used for knee replacement. I will discuss a few pre-surgery checklist items that will need to be completed as we approach your surgery date. We will then move on to topics such as physical therapy, medications that are commonly prescribed, medical equipment, incision care, and managing postoperative symptoms. We will then finish up with a few commonly asked questions, and I will share the different options that you have to communicate with your UCSF care team. The knee joint is made up of three bony components, which include the lower end of the thigh bone, called the femur, the upper end of the shin bone, called the tibia, and the kneecap, which is also called the patella. There is cartilage on the end of the bones, which allows the bones to move easily, and a C-shaped cushion called a meniscus, which acts as a shock absorber between the femur and the tibia. There are also ligaments around the joint that provide support and stability. In an arthritic knee, we see a few changes that often occur. We often see damage to the cartilage, formation of bone spurs, and loss of space between the bones. This leads to common symptoms such as pain and stiffness and swelling in the joint. Our surgeons do a lot of planning prior to surgery and use imaging such as X-rays to determine the appropriate sizing. Implants come in many different sizes, and your surgeon will determine the size that is appropriate for your knee. The femur and tibia portion of the total knee replacement are made of smooth metal. As you can see in the illustration here, the femur portion is rounded, and the tibia is a tray with a notch that goes down into the bone. There is also a durable plastic liner between the femur and the tibia. This is a medical-grade plastic called highly cross-linked polyethylene. The majority of total knee replacements also include a small button of that same plastic underneath the kneecap. I also wanted to share a general overview of the steps that are taken when knee replacement is performed. This is, of course, a simplified version of their expertise and technique. The surgeons start by preparing the bone, which involves removing damaged cartilage and smoothing the surfaces. They then position the metal implants that recreate the surface of the joint. In many total knee replacements, they also smooth the back of the kneecap and place a small button of the durable plastic underneath. The durable plastic liner is then inserted between the metal components to create a smooth, gliding surface. Another procedure that I would like to review with you is called a unicompartmental or partial knee replacement. Our surgeons will determine if this procedure is recommended for you. The indications are based on the pattern of arthritis being limited or isolated to just one portion or compartment of the knee joint, as well as symptoms as to where the pain is located. Now we will move on to information on preparing for your surgery. Prior to surgery, you will have a consultation with our UCSF anesthesia department. They are called the Prepare Clinic, and a member of their team will reach out to you to schedule. The majority of their consultations are conducted over the phone and are scheduled approximately 7 to 10 days prior to surgery. During your appointment, they will review your overall medical history to determine that it is safe for you to have anesthesia. They will also review your medication list to ensure that it is up to date in your UCSF record and provide guidance if you need to adjust how you take those medications leading up to surgery. Our clinic will order blood work that you will need to have collected within 28 days of your surgery date. The Prepare Clinic team will review your blood work and also provide instructions on when to stop eating and drinking leading up to surgery. They will instruct you not to eat after midnight the night before surgery and provide details on when to stop drinking liquids. After your consultation is complete, you will receive written instructions from our Prepare Clinic sent to you in MyChart. Our anesthesia department does recommend that you hold or adjust medications that have potential to thin your blood. This includes anti-inflammatory medications, both over-the-counter and prescription. You will be asked to hold them for 7 days prior to surgery. They will also ask that you hold herbal supplements and some vitamins, such as vitamin E, for 7 days prior to surgery. If you take a prescription blood thinner medication, you will be provided with detailed instructions on when to hold it leading up to surgery. Our goal is to minimize how long you are off of that medication, but also protect you from increased bleeding at the time of surgery. We also coordinate this planning with specialists such as cardiologists and hematologists to ensure that we have a plan to keep you safe. Our department recommends use of an antimicrobial skin cleanser called HibaCleanse or CHG soap prior to surgery. This is one of the steps that we take to reduce risk for infection. HibaCleanse is available in our clinics, many retail pharmacies, as well as online vendors. We ask that you use this product to cleanse your skin 2 nights before surgery, the night before surgery, as well as morning of surgery. It comes in the form of a liquid or foam soap, as well as skin wipes. If you are allergic to this product, liquid dial soap is an alternate option. Focus use of the HibaCleanse on large surface areas, such as your arms, torso, and legs, with more attention to the knee or knees that are being operated on. Avoid using this soap from the neck up to keep it away from your eyes, nose, or your mouth. And a few pointers for day of surgery. If you wear contact lenses, we recommend that you remove them for surgery and switch to glasses. Do not bring home medications with you and remove all jewelry. You will be asked to bring 2 forms of ID for your check-in, including one with a photo. And for day of surgery, you will be asked to arrive approximately 3 hours prior to surgery. In our clinic, we have team members called practice coordinators who will be in communication with your arrival time information. One of the reasons that you will be arriving a few hours before surgery is to allow time for you to meet your anesthesiologist. They will review the options for anesthesia and help you make a decision that is a good fit for you. The surgery takes on average 1 or 2 hours for a knee replacement, or 3 to 4 hours if you are having both knees replaced. After surgery, you will then go to a recovery room while the anesthesia wears off. The majority of our surgeries are being performed at UCSF Mount Zion Hospital or at our Orthopaedic Institute Surgery Center. Some of you are planning to go home the same day, while others are spending the night in the hospital. Your surgeon will have made recommendations on these options with you. Now we're going to review the medications that are commonly prescribed to manage pain after surgery. Your orthopedic care team will make recommendations on medications that are appropriate for you based on medical history and allergies. The prescriptions will be sent electronically to the pharmacy of your choice after surgery, and our hospital or surgery center team will confirm this before you are ready to go home. We currently use a combination of medications which we call a multimodal approach to pain management. These are a few different medications that we have found work well in managing pain when prescribed together. Tylenol is prescribed as a mild pain reliever. Celebrex or Mobic are anti-inflammatories that are often prescribed for pain. And gabapentin is a nerve pain medication that is often prescribed for nerve pain such as numbness, tingling, or burning. Some combination of these medications will be prescribed for you to take on a scheduled basis after surgery. And we also commonly prescribe narcotic or opiate-based medication in addition, but they are taken on an as-needed basis. As pain levels improve, you can reduce the amount of opiates that you take by increasing the interval of time between doses. Be sure to avoid drinking alcohol when taking these medications. Many of our patients feel able to reduce the daytime amount of opiate medications approximately 2 weeks after surgery, and often reduce to taking them at bedtime. You will be sent home with printed information on the medications that are prescribed but your orthopedic team will be available to give you individualized guidance on the medications. We do not expect that you will have no pain after surgery, but the medications should keep the pain to a manageable level. Another thing to consider is that opiate pain medication causes constipation. We often recommend that you take a regimen of 2 medications called Senna and Miralax while taking these medications on a regular basis. It is also helpful to stay well hydrated and consider adding more fiber to your diet. Once you are able to reduce or stop use of opiates, your bowels should return to their normal state. We will also talk about interventions other than medications to help reduce pain before the end of this presentation. Now, before we move into the important topic of physical therapy, I would like to share this recovery roadmap with you. It is important to remember that the recovery is a process, and it is going to take time for you to heal after surgery. Swelling and bruising are 2 symptoms that contribute to pain after surgery, and both tend to increase a few days after surgery. I caution you against overdoing it with activities right after your surgery. It is a natural reaction to want to push yourself and do more when you are not as swollen and sore, but your early recovery will benefit from you taking it easy. You will be assigned a set of home exercises to work on, and it is very helpful to make gentle efforts until the swelling reduces. It is not essential that you are doing every exercise that is assigned right after surgery, as we recommend to listen to your body and let pain be your guide. Another very important focus in the early recovery is walking and movement. I encourage you to get up and move a little, walk or change position every 1 to 2 hours when you are awake. Once the swelling reduces, you will find that the exercises start to feel more manageable and you can increase as tolerated. By week 6, many find that they are seeing much more improvements with overall mobility and pain, but still feel they need more strength and endurance. This will come in time as you work your way up to 12 weeks out from surgery, but you will continue to heal for well over a year after your surgery. Physical therapists play an important role both at our hospital and our surgery centers. They will provide you with either a walker or crutches, teach you how to use them, and make sure that you are moving around safely enough to go home. Another important focus of physical therapy is doing stair training with you if you have stairs to navigate at home. The physical therapist will give you tips and pointers on this as they practice stairs with you. They will also give you a list of gentle home exercises that will include movements that work on bending and straightening your knee. Now, we do recommend that you plan ahead for attending physical therapy in the community. There is some variation on the start time, but the majority feel ready to start around 2 weeks after surgery. Many physical therapy clinics benefit from having a referral well in advance to secure a spot for your sessions. Our clinic will provide the referral, so please do identify a physical therapy center that you would like to work with and share that information with the clinic team. Remember, gentle is key in the early part of the healing process. Many find that the exercises that focus on bending the knee are actually a lot harder right after surgery, and this is related to swelling in the soft tissues. No need to force it, but make gentle efforts and let pain be your guide. We recommend to that time to focus a little more on walking and movement, as well as exercises that focus on straightening the knee. Pumping your ankles up and down is also an important exercise after surgery as it helps to promote circulation. As we approach your surgery date, we recommend that you consider a few things regarding your home environment. Be sure that pathways are clear and free of clutter. It is also helpful to remove small loose rugs to prevent tripping and falling. When your knee is more swollen, tight, and stiff, activities such as moving from sitting to standing and bringing your legs side to side are going to take a little more time. There are some small pieces of equipment that you may find helpful to have, including some items for the bathroom. I also recommend that you take note of the height of your bed. That will be very important information for our physical therapist, so they can have you practice this movement and adjust the size of the hospital bed or gurney to the height of your bed at home. Beds that are very low to the ground tend to be much harder to get in and out of. I also suggest that you move items that are commonly used to areas where they are much easier to reach. It will be more challenging to get down to low positions, and I don't want you climbing to reach any items early on after surgery. Walkers or crutches are provided for you by the hospital or surgery center, so no need to purchase this in advance. Our surgeons allow the vast majority of our knee replacement patients to put their weight down on the surgical leg, but using a walker or crutches is recommended for comfort and safety early on. You may also consider a few items that are available for purchase with medical stores, some large retail pharmacies, or online vendors. Elevated toilet seats with handles can provide comfort when moving from sitting to standing, and some also prefer to have shower chairs or shower benches. There is a kit of small tools called adaptive equipment that are recommended for use after surgery. They are called joint replacement or knee replacement kits and often come in 5 to 7 pieces. The tools that are commonly found in this kit are sock aids, dressing sticks, shoe horns, long-handled sponges, and a reacher grabber. Many find them helpful when reaching down for dressing their lower body and putting on socks or shoes. The reacher grabber is often the most well-loved item in that kit. Now we will move on to incision care. Many of our surgeons use stitches that dissolve on their own, but there are some instances when they may need to use nylon stitches that will need to be removed. The surgical dressing that we most frequently used is a combination of gauze pads directly over the incision, covered by a plastic film dressing called Tegaderm. This dressing will stay on for an average 5 to 7 days, as long as it remains clean and dry. It is okay to shower with this dressing on, but avoid a direct, forceful stream of water. We will ask that you remove the dressing, and the detailed instructions will be given to you by our hospital or surgery center. If you have dissolvable stitches, there is no need to cover the incision back up once the initial dressing is removed. Your surgeon will likely either use surgical glue or small white tapes called steri-strips over the incision. If you have nylon stitches, we will ask that you keep them covered and protected from water. They will need to be removed approximately 2 to 3 weeks after surgery. Please avoid submerging the incision in water, and this includes pools, bathtubs, hot tubs, until the incision is very well healed. I also want you to monitor the appearance of the surgical bandage, the skin surrounding, and the incision once the dressing is removed. You may see a small amount of bleeding that appears under the bandage, and this is typically not a concern. If you see large amounts of bleeding or drainage, or if the area appears to be bright red, it is important that you contact our clinic. We can also view photos if you send them to us in the MyChart portal. If you develop other symptoms such as fevers or chills, we do ask that you contact us directly for guidance. Now we'll take a little more time to talk about the bruising and the swelling. Both are common and expected after knee replacement surgery. Both have a bit of a delayed onset and start to increase a few days after surgery. Bruising will often appear around the incision and on the lower portion of the thigh. The areas of bruising will gradually fade and reduce in size. Swelling also starts around the knee and thigh and will begin to travel down towards the lower leg and foot. We highly recommend that you focus on icing and resting with your legs elevated. Let's start with icing. There are many products available when it comes to cold therapy. The photo that I have chosen is a gel pack. They come in many different sizes and shapes and are flexible. The size pictured here is 11 inch by 14 inch. Initially, you will likely find it most soothing to apply the cold packs directly on or around the knee. As the location of swelling changes, I recommend that you rotate where you place the cold packs. This may be your thigh, your lower leg, or even your foot. Swelling often travels all the way down to the toes before it resolves. In the first 2 weeks, we do recommend that you are using cold packs or icing every 1 to 2 hours when you're awake. Ice packs from the freezer get really cold, so please do not leave them in contact with the same area on your skin for more than 20 minutes. and you may want to use a thin barrier if your skin feels sensitive. Elevation is also very helpful to reduce swelling, but you have to reverse gravity to make that work. Placing pillows and cushions to create an incline like you see in this photo is what we recommend. The goal is to try to get your toes above your nose or as close to that as you can based on pain levels. Resting in this position will allow the swelling to travel back to your body's core where you will absorb it. Just like icing, it's best to aim for 20 minutes every 1 to 2 hours when awake. And to balance this all out, I also want you to pump those ankles up and down and have intervals of movement and walking. I know this sounds like a lot of work, but it does help to bring the swelling down. Another reason that we encourage you to focus on movement and walking and position change is for blood clot prevention. Blood clots are not common, but we do take measures to protect you from them. One of our protective measures will be medication. Current research has shown that aspirin is effective for blood clot prevention for the vast majority of our patients. This is often a course of 81 milligram aspirin that will be taken twice daily for 28 days. If you are already taking a blood thinner, we often get you back on it the day after surgery. Another medication that may be recommended is an injectable medication called Lovenox. This is often recommended if you have a history of blood clots or have a medical condition that makes you more prone to developing blood clots. If you are prescribed Lovenox, the nursing staff in the hospital or at the surgery center will give you hands-on education. We also generally recommend that you avoid air travel for 6 weeks after surgery. There are some exceptions to this, so please let us know if you have air travel planned within 6 weeks from surgery. Symptoms of a blood clot include pain in the calf that doesn't go away, swelling in the calf and ankle that does not improve with rest, ice, elevation, or redness in the calf. Please note that there is a test called an ultrasound that we can order if there's any worry for a blood clot. We ask that you communicate if you are experiencing these symptoms. Now, for this last portion, we're just going to briefly go over just a couple common questions. So, common question, do I have to adjust my lifestyle? Now, when we were looking at the photos of the knee replacement implants, I did share with you the durable plastic liner. We anticipate that for 90% of the implants, they may last upwards of 30 years. In the first 12 weeks after surgery, you are definitely going to be focusing on your physical therapy, walking, strengthening exercises, but it will be okay to gradually incorporate other activities into your routine. We do highly recommend that you start with lower impact activities and then gradually increase. Now, repetitive high impact activities such as running and jumping are often not recommended by our surgeons, even in the long run. It is quite normal to hear some clicking, so you will probably hear some clicking at some point in your recovery. This will gradually improve as swelling goes down and you regain more muscle strength and muscle tone. The skin around the incision is probably going to feel somewhat numb or tingly, and this is also quite common. Early on in the recovery, we do prescribe a nerve pain medication to help with those symptoms, and over time, that area that's impacted will gradually reduce in size. Initially, after surgery, we are going to recommend that you avoid driving until you meet a couple of goals. First, we ask that you are no longer taking opiate pain medication because that can slow your judgment and your reaction time. The second piece, do you feel comfortable getting into and out of your vehicle? And the third piece is, can you react in an emergency? So I know this is a varied range and we can certainly give you individualized guidance on this, but we need to make sure that you feel very comfortable with all three of those requirements before you resume driving. Our clinic can help you with any forms or notes that you need to support time out of work. Please do contact us over MyChart or call our practice coordinators to help facilitate any of this documentation to support you in your recovery. After surgery, when you do fly, you will set off metal detectors at the airport. You are not required to bring any documentation with you when you fly. You just simply let them know at security that you have a knee replacement. Many airports will offer the body scanner if they have that available. But again, you do not need to have any documentation with you stating that you have a knee replacement. The last topic here we'll touch on is the dentist. So very important, if anything happens prior to surgery that you need emergent dental work, please contact our clinic. We need to ensure that there's no worry for infection in your mouth. And also, if a procedure is recommended, do we have time to allow the soft tissue in your mouth to heal? After surgery, there is a bit of a range, so we generally recommend holding off on any invasive dental procedures unless they are urgent for at least 12 weeks. Please do check with our clinic on the timing for dental cleanings, as there are instances where the surgeons may allow that as early as 6 weeks after surgery. When you do return to your dental provider after your knee replacement surgery, they may ask you if antibiotics are needed for routine dental cleanings, and the answer is no. The current guidelines do not require that our joint replacement patients take antibiotics for routine cleanings. Now, we've covered a lot of information today, but I do encourage you to please reach out to our clinic if there's anything on an individual or personal basis that you'd like to discuss. Please let us know. Our clinic has a team, and we all have direct phone numbers that we can share with you. A very important phone number for you to have is the number for the Orthopaedic Institute. When our clinic is closed, this turns into an on-call service. The reason that's important is if you have any urgent issues that you need to discuss with an orthopedic provider, this will reach an on-call provider. That's 415-353-2808. And then, of course, we have MyChart, which is our electronic portal, UCSF-wide, that we use to share a lot of information electronically, to check appointments, test results, send prescription refills. So that's a great way to reach your care team. And we've reached the end of this presentation, so I do hope that you feel more prepared than when you started reviewing this presentation. But again, please know that you have an entire team here in the clinic to help guide you along the process and answer any individual questions that we may not have answered today. Thank you.